Welcome to eHealth Learning, inspiring professionals worldwide.
So the RCT, several important features. So random allocation to intervention groups. So basically you have a treatment group, you have an intervention group, so that would be the group that would have the Bowen. And then you would have your other group, your control group, which would be, it might be, for example, a sham. So they think they're having the real McCoy, if you like, but aren't. It may be somebody totally different. So it could be that you're comparing the effect of Bowen on lower back pain against self-help class or an exercise class, for instance. So you have an intervention group doing one thing and then a second group doing something totally different. And so you have this kind of the difference. What they're looking for, patients are blinded, and if the trialist is blinded too, they're double blind. So what they're looking for is, ideally, the orthodox academia are looking for double blind randomized control trials. And this is the problem we have in complementary therapy, is because if you have a double blind randomized control trial, that means that the therapist doesn't know what the treatment they're giving, and neither does the client, neither does the subject. So actually, as a Bowen therapist, technically, if we're double blinded, we don't know whether we're giving a Bowen treatment or not, and that's impossible. It's different if you're giving a tablet. So basically, a man in white coat, we'll call him the doctor, gives a white tablet to the subject. He doesn't know what that tablet is, and neither does the subject. Then that would be a double blind study. But in kind of virtually all complementary therapies, certainly where there's the manual intervention, it can only be a blind RCT. You can't have a therapist not knowing what treatment they're giving. Okay, so all intervention groups are treated identically except for the experimental treatment. So basically, as far as, like, for instance, with the Bowen and the lower back pain study that I did, the Bowen treatment varied from person to person according to what they needed. But the control group, which we put together a sham treatment, so actually what we tried to do was to capture the elements of a Bowen treatment, so the touch, the movement over the skin, the light pressure, but not actually capture the elements that might actually produce the effects that the Bowen did. So we didn't want the rolling type move, we didn't want the pressure. So we used the back of the hand, and we just brushed it over the skin. So we just sort of worked over. So there was still the contact onto the skin. The subject still felt as touching them. The format for the sham treatment, we used pages 1, 2, and 3, or BM 1, 2, and 3, and so we used those points, and we just brushed our hand over the back of the skin, and so we used that, and that was our control treatment. So that was our sham, and that was part of the study, was to actually see whether we could develop a sham treatment for Bowen research into the future. And so basically the control group had exactly the same treatment every time. So they had this over 3 treatments. So we did a 3-treatment model, and so they had this every time. And the Bowen people had their 3-treatment model, but their treatment varied according to what they needed. Okay.